Hello, I'm Dr. Dean Elterman from the University of Toronto. It's my pleasure to present willingness to pay for a minimally invasive surgical procedure for benign prostatic hyperplasia among men with moderate to severe symptoms. This is on behalf of my co-authors. These are my disclosures. Let's begin with some background. Water vapor thermal therapy, or Rezūm, is a minimally invasive surgical procedure for the treatment of lower urinary tract symptoms secondary to benign prostatic hyperplasia. What's unique about this minimally invasive therapy is that it can be performed in an office setting as well as an outpatient. It does not require general anesthesia or a main operating theater. Uniquely, it is not available in Canada within the public Medicare system, nor is it available with private health insurance. Rezūm is only available to men suffering from moderate to severe BPH who are willing to pay out of pocket $5,900 Canadian for the procedure. In terms of the study objective, this was to assess willingness to pay of Canadian men with moderate to severe BPH LUTs who underwent water vapor thermal therapy at a Toronto urologic clinic. The methods were an online survey of Canadian men with BPH LUTs to assess their willingness to pay for the Rezūm procedure. All these patients already underwent the water vapor thermal therapy procedure between April 2019 and November 2020 at an academic urologic clinic in Toronto, Canada. The survey was distributed to 170 patients, and approval was received from the ethics board at the University of Toronto. So the survey design was adapted from previously validated methodology on willingness to pay, which has been published in the peer-reviewed literature. The survey questions analyzed first patient demographics, as well as the willingness to pay question as it pertained to water vapor thermal therapy. So the willingness to pay question was the following. Looking back at your water vapor thermal therapy procedure and how you are doing today, what is the most money you would be willing to pay for the water vapor thermal therapy procedure? So 128 out of 170 patients responded, 75% response rate. And the demographics were set out here before you. The majority of men were between the ages of 60 to 69, mostly Caucasian and married. Most of them were retired, though some were still working part-time. And in terms of mean household income, 66% had $100,000 or more. Looking at the mean willingness to pay for water vapor thermal therapy, it equaled $6,330 Canadian. And you can see there the distribution with the majority of people answering pretty much what they paid, $5,900. But in fact, 42% of patients were willing to pay more than the $5,900 Canadian dollars. That was the actual price of the Rezūm treatment. In terms of strengths and limitations, firstly, in terms of a strength, this was the first study to explore willingness to pay for water vapor thermal therapy. And this is unique because these procedures are not covered by public or private insurers. And so a patient's willingness to pay the out-of-pocket amount should complement the clinical and procedural considerations when choosing the appropriate BPH procedure. In terms of some limitations, the study only included Canadian patients treated at a single Toronto center undergoing water vapor thermal therapy. And of course, willingness to pay may differ due to geographic differences as well as changes in procedural cost. So in conclusion, in the Canadian healthcare system, you have to remember that nearly all BPH treatments are paid for by the public Medicare system at no cost to patients whatsoever. And yet Rezūm water vapor therapy is fully out of pocket. And so while it is not covered by the public or private health plan, men in this study on average were willing to pay $6,330 Canadian dollars out of pocket for the water vapor thermal therapy. And in fact, 42% of men undergoing Rezūm or water vapor therapy were willing to pay more than the actual price of the procedure. And so we believe the results of this study demonstrate the meaningful monetary value of water vapor thermal therapy to men with BPH. I'd like to thank the ICS for this opportunity.